So I started testing all my patients, and every last one of them were vitamin D deficient. And then we broke them up into groups. For the African American women, they had the lowest vitamin D levels. Their vitamin D levels was 9. African American males had the second lowest levels. Their levels were 12. Caucasian males and females were about 18. And so we looked at mortality rate at the same time we looked at vitamin D levels, and then we looked at hospital costs, ICU costs. So the people with the highest mortality rate were the African American females. They had the lowest vitamin D level, but the highest mortality rate. And they had the highest ICU costs, so they stayed in ICU longer, more days. ICU bed costs $4,000 per day. That's just to be in the room. That's not counting the ventilator, the dialysis, and all the surgical procedures that we do on you. So that's just $4,000 a day. A bed on the floor in the hospital at Grady costs $1,400 a day. So I told my residents, if I'm ever a trauma patient, stabilize me and transfer me to the Ritz-Carlton. A suite at the Ritz-Carlton with a jacuzzi costs you about $300 a day versus $1,200 a day for a floor bed in the hospital. So we noticed all this, and so once we start supplementing, we use the 50,000 international units of vitamin D. So hospital administrators were screaming their head off, thinking all these patients are going to be toxic. And so, like I said, they didn't understand the science that everybody's level dropped 50% in 24 hours of being in the hospital. And then if you're on certain medication like steroids, seizure medications, HIV medication, it dropped your level even more, like up to 80% a day. And so we started supplementing these patients with high dose vitamin D, 50,000 IUs daily. And we noticed that the mortality rates of all these different groups that I described, drop to the same. So most healthcare disparities are due to their physiologic or biologic, due to vitamin D deficiency, and not so much as socioeconomic factors like the medical community thought. So so we got our mortality rate down to 3%, and we talking about in a level one trauma center, the fourth busiest level one trauma center in the whole country. And our patients started doing better. We cut heart attacks in half, strokes in half, falls in half. Um, so all our indices got better.